Mr. D, who has been on dialysis using his AV graft. So what's the difference between an AV graft and AV fistula? Again, AV graft, the fistula is a direct connection between artery and a vein. Graft, you have a stent between an artery and a vein. So this patient has a graft now for a few months, presents with fever, chills, and arm pain. It appears that the site over his graft is red, tender, and warm. The patient's white count is elevated and is febrile in the ED. What would you like to do here? So this patient has a graft, okay? He comes in with some sort of an infection. You felt his arm and you feel like the arm or his graft, it's around his dialysis site. It's red, it's tender, it's warm. This is a very common admission in patients with dialysis. The patient's white count is elevated, febrile. So you know that there's an infection going on here. What would you like to do? So AV graft infection is actually a pretty common admission to the hospital. These patients usually come in, they're sick, they have a fever, they have a white count, and sometimes they tell you it hurts around that site. You take a look at it, it looks red, you feel it, it's red, it's hot, it's tender. These patients can also have bacteremia, so a lot of times from that infection, that bacteria could leak into the blood, causing bacteremia. So what we usually do is get an ultrasound and check that site and see if there's any kind of abscess or infection around the AV graft. Start this patient brought antibiotics like vancomycin, cefepime. We don't know what bacteria is in it. Could be MRSA, could be, again, any of the gram-negative rods, staph, strep. And then you consult vascular surgery to see if that needs to be removed, okay? And it's unfortunate, but sometimes these grafts need to be removed because, again, of the risk of infection and if they are infected.